This is Scott Becker with the Becker's Healthcare Podcast. Thrilled today to be joined by a brilliant leader at LaSalle Network. We're joined today by Miriam Merens. And Miriam spends her time, particularly in the healthcare area, on staffing, recruitment, helping health systems, helping private equity sponsored companies, and a lot more. Miriam, can you take a moment to introduce yourself to the audience and tell us a little bit about LaSalle Network?
Of course. Like Scott mentioned, my name is Miriam. I've been with LaSalle for over almost close to a decade now, which is crazy to think. I lead our healthcare division. When I started about 10 years ago, we had one client in the space. Now we have about 60 across the US. LaSalle is staffing and recruiting, and we've been in business for 25 years.
And talk about sort of the growth in that client base and where does that growth come from? What types of clients? Is it big health systems? Is it entrepreneurial companies? What does that look like a little bit?
Yeah, so I would separate our book of business into three areas. One would be your hospital and health systems. The second one would be your outsourced RCM companies as well as consulting companies. And then the third bucket we deem as specialty, but that could be anything from physical therapy to home infusion to behavioral health.
And Miriam, you've had this great career. I think you've been at LaSalle Network for how long now?
It's going to be 9 years in October.
I mean, that's an amazing run. You've developed into a fantastic leader. Talk a little bit about to a young careerist, an emerging leader. What advice would you give to a young careerist and emerging leader?
Yeah, I would say on the young careerist side, definitely trust the process, do what you're told, and work really hard. I came from revenue cycle and transferred over into staffing and recruiting, and it was two different worlds. But, being able to truly go from productivity to becoming a leader in the space and truly understanding clients. I think a lot of people want to have a mass solution to either a problem or employee engagement or retention. And that's just not the way of the world. And being able to provide a solution that's really catered either to your client, to the specific issue and revenue cycle, is what makes a good leader in my eyes. And then also never being the smartest person in the room. I know it can be intimidating, but I've built my career on elevating the people I keep around me and always learning from other people and their experiences within healthcare, within revenue cycle, and within staffing.
Thank you. And talk a little bit. You mentioned this evolution, and a lot of people don't sort of see this as clearly. This evolution from a mix of being just productive as a young person in a firm, typically just a productivity person, you're doing a lot of tasking, a lot of things. And at some point you evolve to leadership and management of managing others. And sometimes that's very hard because people are used to getting judged on what they produced, and it's very linear. Talk about that evolution and emotionally to manager leader from being from being a productive to being a doer and manager. Talk a little bit about that evolution.
Yeah, I think it's a lot about time management and then understanding your employee or your client as an individual and really, again, catering to them. The evolution of, hitting a KPI to being a strategic partner takes obviously time and effort, but it also is where you go from not just a salesperson, not just a staffing partner, you go into someone that clients call for strategic advice or different routes or different set of eyes on how they're looking at a specific implementation. And so I think, really looking at the business from a different scope and less focused on the KPIs that you hit in the beginning and more so how do you take that next level to elevate not only yourself, but your clients and then the people you surround yourself with.
Thank you very, very much. And then in the healthcare staffing world, so much has changed over the last several years. I mean, just even a couple of years ago, people were fighting just to staff themselves. So they're spending a ton on contract labor. What are the trends you're watching in staffing today in healthcare facilities and healthcare? What's front and center currently?
Yeah, I would say the number one trend is employee engagement. We recently published a white paper and we found that a third of the people that responded don't feel a sense of belonging to their organization. And 77% of them actually said that if another job was offered to them, they would consider it. And so when we're operating in a world where hospital operating margin, the average is 13.5%, hospitals no longer have the budget to hire and rehire and add more people. So you've got to do the best with what you have. And so we've seen creative employee engagement really be top of mind and have been able to partner with our clients to come up with solutions outside of the normal day-to-day that you're seeing.
Thank you. And talk a little bit about, as you keep on evolving, keep on growing this healthcare vertical, what are you most excited about? Talk to us a little bit about that. What are you most excited about currently?
Yeah, I would say one thing that I am really excited about is, understanding where healthcare staffing is going and being able to provide those solutions to our clients. So, one thing is healthcare used to be, let's hire a bunch of people because there's another competitor closing or there's a different change in reimbursement and we need to capitalize on this. And now it's how can we use the tools we have to be able to do the most with what we have. So, automation obviously is a hot topic. It's been brought up at numerous conferences, and I think using it also as an employee engagement tool is a new look on it. Being able to automate the repetitive tasks from a day to day and have your employees focus on higher level work will really keep their engagement within the company, within the health system, and allow them to feel like you're further engaged in them. And so I think, taking a different look when it comes to AI, also taking a different look at your employees in general. We hire in someone to be in patient access and we give them a growth plan that's specific to patient access. You're a supervisor, manager, director, but we're not taking our employees and giving them a growth plan that's throughout the organization. If someone in patient access wants to be a coder, as an employer, giving them the ability to do that and showing them how to do that, will help engage the employee and keep good talent within your department. So really trying to think outside of the box is where I think the next 6 to 12 years are going to be in staffing. And I think, adding more than just your daily one-on-ones, really taking that next step and elevating your employees.
Thank you very, very much. A word about, the founder of LaSalle Network, Tom Gimbel. A word about his leadership and mentorship, if you don't mind for a moment.
Of course, yes. So Tom was our founder. He was an amazing mentor to me and still is to this day. He empowered us as young salespeople to, go out and meet with the C-suite of companies and meet with the directors and ask for forgiveness, not permission. And I think that has allowed the salespeople under his org to really blossom and really be able to elevate themselves and take them to the next level. And, he's been sending me to Becker's conferences since I was an entry-level salesperson. And I can tell you that's been another outlet for me to grow. And so I think he invests a lot in his people and puts them in situations where they are almost forced to elevate themselves. And I think that's really what's made a lot of the sales team at LaSalle successful.
And to the credit of LaSalle, so many junior people that started there have stayed there for a long time, and he had fabulous careers, and it's a real tribute to the company and the culture that has been built there. Take one more question in terms of the psychology background. How important is the psychology background to leadership? And does it help you think through sort of how you manage people, how you think about people?
100%. I think one thing that psychology has taught me is, making sure that you understand the person that you're meeting with on an individual level and read body language, get to know what's important to them. One example I constantly use, and I've actually applied to my day-to-day when I engage with different clients, is I spoke with a revenue cycle leader about, now it's like 3 years ago, but I tell the story probably every 6 months. And I admire her greatly, has had great employee retention because she's made custom solutions to them. So she had an employee that was looking to learn Spanish. and she happened to speak Spanish. And in, making an individual solution to them, they started to do their one-on-ones half in Spanish and half in English. So if surrounding myself with leaders in the space, I've learned that having individualized solutions and really reading the body language, reading what's important to them, getting to the why behind the why, all comes from having, that psychology background and really taking the time to understand people.
Thank you very, very much. Miriam, it's a great pleasure to visit with you today. People could find you, Miriam Merens at LaSalle Network. What a tremendous leader, young leader. I guess not that young, but still, to me, very, very young. What an amazing leader. What an amazing career. Miriam, thank you so much for joining us today on the Becker's Healthcare Podcast.
Thank you so much. I would be remiss if I didn't mention that this has been a goal of mine since I started almost 10 years ago. So excited to be here, and thank you for having me.